Now to a health alert. Doctors around the world are trying to figure out why more children are getting hepatitis. Recently, cases have been reported in at least 10 states.
While the Virginia Department of Health says there are no reported cases here, Angela Vargas found out what types of symptoms parents need to watch out for.
Positive cases of severe hepatitis in children are causing some parents to worry.
To think about my kid going through that's horrifying.
Alexandra Self says she is always on alert when it comes to her son's health.
I already have an autoimmune disease, so he's already at risk.
Adding to the concerns is that the cause of infection is unknown.
Hepatitis isn't unheard of, but for them to have never heard of the strand or where it's coming from or how it's being transmitted, that's scary.
The CDC and the World Health Organization sent out letters advising health departments to be on the lookout for any hepatitis cases showing up without a cause. They reported many of the children who got sick were healthy, but others had to receive liver transplants.
That's sad that a child had to go through that at such a young age, because that's not fair.
Virginia Department of Health officials also sent out a message to the medical community, especially to pediatricians. Newport News Children's Clinic Dr. Elizabeth Broderick can't believe this is happening.
I've never seen kids catch what looks like a routine illness and then get a life-threatening hepatitis.
Dr. Broderick says the good news is this type of illness is rare, but there are symptoms parents need to look out for.
If this doesn't look like the normal GI bug, if they're in more pain and more tired, and if their skin or the whites of their eyes discolored yellow, we need a phone call.
VDH officials say they have started their surveillance efforts for potential cases in the state. Again, there are no cases that have been reported here. Angelo Vargas, 13 News Now.
Last month, the World Health Organization officials said at least 169 cases of acute hepatitis had been reported from 11 countries in Europe and some in the U.S. The children's ages ranged from 1 month to 16 years old.